Andrew, you've got some very interesting information from the authorities in New South Wales about a lack of compliance happening.
I have, Kieran. A day after COVID-19 cases went past the 1,000-a-day mark again in New South Wales, Sky News can reveal 4 different incidents in the past week where the police operation to attempt to bend the curve has picked up people who are COVID positive out and about in the community. One of the keys to suppressing a Delta outbreak in places like Singapore and Hong Kong has been putting people with COVID straight into strict quarantine. And it was only on week 7 of this outbreak that New South Wales Premier Gladys Berejiklian moved to bring in the army and have that police operation monitor more closely those supposed to be isolating. Now police are visiting 7,000 COVID positive people or close contacts of COVID every day. And here are the 4 incidents involving COVID positive people. One was a passenger found on a train from Seven Hills to Parramatta at 4 p.m. on Tuesday who was not wearing a correctly fitted face mask. The 31-year-old Bankstown man, who's now in custody, was subject to an outstanding warrant for 3 counts of failing to comply with the self-isolation direction already and was found to be COVID positive. Then on the Upper North Shore at 6:30 p.m. on Thursday in Asquith, a 39-year-old woman from Tregear and a man were approached by police in a stationary car. The woman had returned a COVID positive result and been directed to isolate. Also on Thursday, about the same time, a 17-year-old youth stole a wallet from a man's car in Doonside, used the credit cards at nearby stores and was arrested and admitted to being COVID positive. Then on Friday, police were tipped off to the fact that a 27-year-old Parramatta man was not in self-isolation. He was found and admitted to being COVID positive and having been active in the community. The incidents show the importance of proper compliance operations to stop the spread of the virus and indicate why police believed a curfew was necessary in hotspots to attempt to bend the curve of cases. And indications from recent numbers is the spread may be slowing, albeit very slowly. I can also reveal that of the 125 cases in intensive care in New South Wales at present, they include a fully vaccinated nurse at Westmead Hospital, as I understand it, and that nurse is intubated. Health sources tell me that that nurse had applied for an exemption because of a medical condition not to work in the COVID ward, but that exemption was not renewed, and this is the subject of some concern amongst nurses at the hospital. Our prayers and best wishes to that nurse and her family, Kieran.